Hey there, Dr. Mamina here. So do you deal with eczema flare-ups? If you do, you're not alone. Luckily, some of the best ways to approach eczema is through a holistic, kind of more integrative approach with different lifestyle practices as well as specific products, whether they are over-the-counter or prescription, to really help with your flares. But first, let's discuss eczema and understand what exactly it is. So eczema refers to a chronic skin condition with dry, itchy patches and plaques in different parts of the body. In derm, we often use the term atopic dermatitis when we think of the word eczema, but I'll explain the difference between atopic dermatitis and eczema in just a little bit. People with eczema usually have a weakened skin barrier function. And your skin barrier is responsible for helping your skin hold onto moisture, and it also protects your body from outside elements like allergens, irritants, bacteria. So when this barrier is compromised, it can lead to increased moisture loss as well as susceptibility to external triggers. And then it turns into annoying itchy rashes. So eczema can show up in various forms. I look at it as an overarching term of rashes on the skin associated with a compromised skin barrier, and there are different forms of it. So atopic dermatitis is the most common form of eczema. And like I said, eczema to me is more of an overarching term. It's more of a description of a type of rash, whereas atopic dermatitis is a little bit more specific in terms of its presentation. So with atopic dermatitis, you'll often get itchy patches and plaques, mostly found inside the elbows or behind the knees, but honestly, it can affect anywhere on the body. It can affect the full body in severe cases. And we commonly will also see it just on like the cheeks in young children. The symptoms and presentation can definitely vary from person to person. Atopic dermatitis is closely related to other allergic conditions like hay fever and asthma, since they share a very similar inflammatory process. Then there's other forms of eczema, like hand eczema. This is another common type seen in adults. I tend to think that hand eczema is something that we see in people who are more predisposed to atopic dermatitis. Then there are also just eczematous kind of rashes that flare up from various triggers like allergic or irritant contact dermatitis. Then there's asteatotic eczema, which is a rash that occurs from really dry skin. And then there's viral rashes that can have an eczematous type of appearance to them. And there are like drugs or medications out there that can bring on a rash that's an eczema kind of rash. So eczema isn't like a one-size-fits-all condition. It comes in different forms and can be caused by a variety of different factors, which is why it's important to just be familiar with how it presents so that you know how to manage it properly. So this brings me to some of the most common causes and triggers of eczema. So specifically with atopic dermatitis, it's characterized by an immune system that leans more towards inflammation involved with allergies. If you're into immunology, it's more of a Th2 kind of process. So this means that the body's response to certain irritants or allergens is heightened, leading to the eczema symptoms. Another big factor in eczema is genetics. So there's mutations in things like the filaggrin gene that have been linked to an increased risk of atopic dermatitis. Filaggrin is a protein that plays a crucial role in maintaining the skin's barrier function, and mutations in this gene can compromise your skin's ability to hold moisture and protect against external triggers. I mean, people with the filaggrin mutation definitely have a more compromised skin barrier. There's also environmental factors that can lead to eczema flare-ups. So these include exposures to things like smoke, pollution, fragrance, harsh soaps, certain fabrics, dry air, or the extreme opposite with high humidity and heat. These all can increase your likelihood of symptoms. Even certain skincare products or makeup containing irritating ingredients can really trigger flare-ups for sensitive skin. And then your mental health can affect your eczema management too. Stress, anxiety, depression, these all have been shown to worsen eczema symptoms due to the body's heightened inflammatory response during times of stress. Then there's also food allergies, things like peanuts, dairies, eggs, which can also trigger atopic dermatitis flare-ups. We're also seeing more evidence arise with an imbalance in the gut microbiome that has been shown to be linked to eczema development. Atopic dermatitis is a condition that's inherent in people. You can certainly keep it at bay by identifying triggers, but for other forms of eczema, oftentimes you can get rid of it if you can address the triggers. And then of course, there are a variety of treatments out there. There's even some that you could first try at home to soothe that dry, itchy skin. So first, I'll touch on at-home treatments, the more conventional ones, and then I'll talk about more holistic or alternative options. And then I'll go into the more conventional prescription treatments that a derm would give for somebody with eczema or atopic dermatitis. So first, and Most importantly, people with eczema really need to keep their skin moisturized. So to really help minimize your skin's moisture, you want to minimize things like hot showers or bath time, use lukewarm temperatures instead. And this is really important to not only do during your flare-ups, but also when your skin is clear to kind of prevent future flares. So after showering, moisturizing at least once a day, ideally while it's still damp, is also very helpful. When moisturizing, I recommend using thicker products, so use a cream or ointment-based moisturizer over more like liquidy or watery lotions. And there are certain ingredients I like things with ceramides, shea butter, petrolatum, dimethicone, colloidal oatmeal, glycerin, squalane, sunflower oil. These all are great at moisturizing, hydrating, soothing, and also some of these occlusive ingredients can really help lock in that moisture. I'm a big fan of a variety of different moisturizers. I'm a fan of La Roche-Posay, CeraVe, Cetaphil, Aquaphor, Eucerin, Vanicream. Skin Fix makes great moisturizers. It's also important to minimize exposure to potential allergens, so things like fragrances and dyes in skincare products and laundry detergents. These can irritate your skin. So you want to look for things like fragrance-free. You want to look for gentle soaps and hypoallergenic options. Those should be your go-to when you're choosing various household products. You also want to be mindful when choosing comfortable fabrics for clothing and bedding, such as cotton or bamboo. These can also help minimize irritation and promote better sleep quality, because that's something that can get affected, your sleep, if you're just itching so much. So during eczema flares, topical over-the-counter treatments can provide additional relief. You want to use moisturizers containing colloidal oatmeal for more severe itching. Look for a 1% hydrocortisone cream too. If you're experiencing recurring skin infections, mild bleach baths can be helpful. I know that sounds scary, but it's actually a long established treatment for eczema. And when used at a very diluted amount, it's safe for the skin and gets rid of that bacteria that can trigger eczema flares. So what I tell patients is to add a 1/4 cup of bleach to a tub of water and soak for about 10 to 15 minutes, then rinse off afterwards. Another thing I'll recommend, I probably do this even more now, is hypochlorous acid sprays or washes to help reduce bacteria. So there's the Tower 28 SOS spray. There's also the CLN body wash. I recommend that a lot, especially for kids with eczema. Okay, so now looking at the more holistic or alternative treatment options at home, there's coconut oil, and that's often known for its antimicrobial effects, but I like sunflower oil even more as a moisturizer. It's much lighter in texture and does not always clog pores like coconut oil can potentially do. I still think that if people like coconut oil, they can certainly use it on their body. I just wouldn't use it on your face. Honey is another ingredient that can be used topically for eczema patches. This can help promote healing and soothe inflammation. I wouldn't just use any honey. I would look for more medical grade honey or Manuka honey, or really products that incorporate honey. There's a brand called Eczema Honey that I think does a good job with this. Tea tree oil also has antimicrobial properties, but I'm a little bit more hesitant to recommend this because at higher concentrations, it can definitely cause irritation. So I'd say use that with caution. And then there's diet. So dietary changes can also relieve symptoms for some people. We talked about allergens earlier, like dairy, peanuts, and eggs, but other common triggers can be things like seafood, gluten, or nuts, other nuts besides peanuts. And the data is still growing in this field, but probiotics have been really found to be helpful in the setting of atopic dermatitis. So that is something that I would recommend to help support your gut health and reduce inflammation. And there are a variety of strains that are helpful, and I am listing some here. Lactobacillus rhamnosus GG is probably the most studied, but there's a lot in the Lactobacillus family and some in the Bifidobacterium family. Okay, so staying on the holistic wellness train, there's a study that shows that acupressure at a specific point on your body, on your arm, it's a great remedy for itching associated with eczema. The part on your arm that you can massage is called LI11, which stands for large intestine 11. The study was done by dermatologist colleagues of mine, Dr. Peter Leo and Dr. Jennifer Hensley, so you can check it out. So by incorporating these lifestyle changes or habits into your eczema management routine, you're able to take a more integrative approach to skin health and reducing your flare-ups. So, experiment with different methods to find out what works best for you, and remember to consult with your dermatologist for more personalized recommendations, of course. Okay, so for more stubborn or persistent eczema, there are, of course, conventional prescription treatments that you can use alongside your home remedies if the home products alone aren't helping. Derms often will prescribe steroid creams for eczema. Steroids include things like hydrocortisone, as well as triamcinolone or clobetasol. These work by reducing the immune response in your skin, so this helps reduce redness, swelling, itching. Steroid creams have alleviated so much suffering in people with eczema, but they are not a good long-term solution. Same with oral steroids, which is why derms also prescribe non-steroidal meds with anti-inflammatory properties, things like tacrolimus ointment, pimecrolimus cream, new ones like ruxolitinib cream. There's also crisaborole ointment. So these can also suppress the inflammatory response in your skin to give you that relief without the potential side effects associated with long-term steroid use. There's always side effects with everything though, so obviously this is a discussion to have with your dermatologist. So if you have more severe or persistent atopic dermatitis, that is where systemic medicines come into play, things like pills or injections. Something that we give often is dupilumab, or otherwise known as Dupixent. This has been a game changer just because it has been a very safe medicine and it works really well at relieving a lot of itching, redness, swelling, any kind of rash associated with eczema. So Dupixent, this is a biologic therapy that targets specific molecules in the inflammatory process of atopic dermatitis, and it works well. It's not for everyone, but we just like it because you don't have to check blood work, and it's safe for babies as young as 6 months of age. And then for some people, there's phototherapy with narrowband UVB, and this can also be reserved for people who can't tolerate other medicines. Narrowband UVB works on a specific layer of skin to help reduce inflammation that's occurring at that layer of skin. And even though it is a form of UVB light, it does not increase your risk for skin cancer, so no worries on that. Not all institutions offer narrowband UVB, so that is something that you might want to discuss with your derm to see if you need to do that somewhere else if their office doesn't have it. And as always, it's important to talk to your dermatologist in general to determine the most appropriate treatment plan for your eczema needs. I'm a huge fan of identifying environmental triggers and exploring remedies at home to calm your skin. So I hope you found this video on eczema and eczema remedies to be helpful. If you enjoyed this video and you want to learn more about skincare, be sure to download my free gift, my top 5 skincare favorites. And remember to hit that like button, share this video with your friends and family, and subscribe to my channel to start your holistic wellness journey for your mind, body, and skin. Thanks for watching.